ADHD, Attention Deficit Hyperactive Disorder, by Stephanie Joseph of Indiana State University, Nursing 444, Community Health Nursing, Health Education Project Number 5.
Pre-test. Let's start off with a couple of questions to see and test your knowledge about ADHD. 1. What is ADHD? 2. Who does ADHD affect? 3. How is ADHD diagnosed? 4. What are some characteristics of ADHD? And 5. Who is usually diagnosed with ADHD more? For this presentation, the learner objectives are: the learner will be able to define ADHD. The learner will be able to describe how ADHD is developed. They will also be able to explain how ADHD is diagnosed. The learner will be able to describe signs of ADHD and explain ADHD treatment options. And lastly, the learner will be able to describe lifestyle support that can be made to help manage ADHD. Okay, so let's start off with defining what ADHD is. ADHD stands for Attention Deficit Hyperactive Disorder. It is a medical condition. A person with ADHD has differences in the brain development and brain activity that affect attention, the ability to sit still, and self-control. ADHD can affect a child at school, at home, and in friendships. Who does ADHD affect? Millions of U.S. children have been diagnosed with ADHD. The estimated number of children ever diagnosed with ADHD, according to a national 2016 parent survey, is 1 in 6.1 million. That's 9.4%. This number includes 388,000 children from age 2 to 5, 2.4 million children aged 6 to 11, and 3.3 million children aged 12 to 17. It is said that boys are more likely to be diagnosed with ADHD than girls, roughly around 12.9% compared to a 5.6% in girls. What are some signs of ADHD? One is inattentive. Kids who are inattentive are easily distracted. They have trouble focusing their attention and concentrating and staying on task. They may not listen well to directions and may miss important details, as well as may not finish things that they start. Another sign is hyperactive. Kids who have hyperactive are fidgety, restless, and easily bored. They may have trouble sitting still or staying quiet when needed. They may rush through things and make careless mistakes. They may climb, jump, or roughhouse when they shouldn't without meaning to. They may act in ways that disrupt others. Impulsiveness is also a sign of ADHD. Kids who are impulsive act too quickly before thinking. They often interrupt, might push or grab, and find it hard to wait. They may do things without asking for permission, take things that aren't theirs, or even act in ways that are risky. They may have emotional reactions that seem too intense for the situation. And lastly, attention, activity, and self-control develop little by little as children grow. Kids learn these skills with help from their parents and teachers, but some kids don't get much better at paying attention, settling down, listening, or waiting. When these things continue and begin to cause problems at school, home, and with friends, it may be a sign that your child has ADHD. What causes ADHD? It is not clear what causes the brain differences of ADHD. There is strong evidence that ADHD is mostly inherited. Many kids who have ADHD have a parent or a relative with it. Kids also can be more at risk for having ADHD if they were born early, are exposed to environmental toxins, or their mothers use drugs during their pregnancy. ADHD is not caused by too much screen time, poor parenting, or eating too much sugar. Those are all myths. Now, let's look at how ADHD is diagnosed. To diagnose ADHD, doctors usually start by asking about the child's health, behavior, and activity. They talk with a parent and the child about the things they've noticed. The doctor may even provide you with a checklist about your child's behavior and might ask you to give your child's teacher a checklist as well. After gathering the information, doctors diagnose ADHD if it is clear that a child is having trouble paying attention, they're very hyper, or very impulsive beyond what their age's scope. The behavior that the child is experiencing may have been happening since they were young, and that behaviors have affected the child at school and at home. And lastly, if the child has a health check that shows other health issues or learning issues isn't causing these type of problems. Many kids with ADHD also have learning problems, oppositional and defiant behaviors, or mood and anxiety problems. Doctors usually treat these along with the ADHD. The doctor can refer you to a child psychologist or psychiatric person if needed. How is ADHD treated? Treatment for ADHD usually includes medication. This activates the brain's ability to pay attention, slow down, and use more self-control. There's behavior therapy, which therapists can help kids develop social, emotional, and planning skills for their lagging with ADHD. There's also parent coaching. Through parent coaching, parents learn the best ways to respond to behavior problems that are part of ADHD. School support. Teachers can help kids with ADHD do well and enjoy school more. The right treatment helps ADHD improve. Parents and teachers can each teach younger kids to get better at managing their attention, their behavior, and their emotions. As they grow older, kids should learn to improve their own attention and self-control. When ADHD is not treated, it can be hard for kids to succeed. This may lead to low self-esteem, depression, oppositional behavior, school failure, risk-taking behavior, or family conflict. How can parents help? If your child is diagnosed with ADHD, be involved. Learn all you can about ADHD, follow the treatment your child's healthcare provider recommends, and go to all recommended therapy visits. Give medication safely. If your child is taking ADHD medicine, always give it at the recommended time and dose. Keep medicines in a safe place. With your child's school, ask the teachers if your child should have an IEP or a 504 plan. Meet often with teachers to find out how your child is doing and work together to help your child do well. Parent with purpose and warmth. Learn what parenting approaches are best for the child with ADHD and which can make ADHD worse and what can make ADHD worse. Talk openly and supportively about ADHD with your child. Focus on your child's strengths and positive qualities. Connect with others and for support and awareness. Join support groups like CHAD or ADHD to get updates on treatment and other information. ADHD can improve when kids get treatment, eat healthy food, get enough sleep, and exercise, as well as have supportive parents who know how to respond to ADHD. Now that you've gathered all kind of information about ADHD, you're ready to tackle this post-test. Answer the questions and test your knowledge and how well you did on paying attention to this presentation. You've completed the informational presentation about ADHD. You have newfound knowledge that can be applied to many aspects of your life. If you have any questions, just check out the references below.